Hi, Carolyn. Thank you for chatting with us today. You've been a longtime supporter of ASH, so I just wanted to take a little time to sit down with you today and find out why you're a supporter of ASH and why this is such a crucial issue to you.
Well, it is my pleasure to be here. And so, first of all, people probably notice I'm in the car because I live off grid. And the other thing, too, just to say, my dog, who is leaning on my arm right now, he may pop into the picture because he sometimes likes to
It's
snuggle. So,
fine.
we're both of us are ASH donating to our time and effort to ASH for this. So, the reason why I like ASH, actually, in smoking and health, actually. I was aware of it back in the day when it was one of the main, most prominent tobacco control organization in the country. And that's back with John Banziff when they were working on smoke-free environments, smoke-free airplanes, etc. So it's an organization that I've been aware of for a very long time. And then when it became so critical to the Framework Convention Alliance is the next thing sort of in my mind that impresses me about ASH, that it was a secretariat for, I don't know. I think it started out when I became aware of it, like 350 not-for-profit organizations around the world, and then growing to, I think it's now over 550 in countries that are party to the Framework Convention. And then going to one of the COP, the Conference of the Parties at the Framework Convention, seeing how ASH and the Secretariat, so being the Secretariat for this, was so powerful. And so actually, it was fun. It was intellectually challenging. It was watching diplomacy in action, like how do you move things forward internationally on a treaty, and to know that this was with hundreds of colleagues from around the world, from every type of country from around the world that was working on the issue that started me on my professional career, which is having fewer people die from tobacco. And so I was able to meet all these amazing people working on an amazing target. And the secretariat of that had been ASH.
Yeah.
So something that so impresses me, the ability to do that and watching it in action, the people in action, the secretariat in action, the conference of the parties, etc. So that was one issue that I was just so impressed about ASH. The next one is I had worked with the concept of human rights-based approach to tobacco control, and Chris Bostic had been on that international board for many, many years. And as I was retiring, which allows me to live off grid now, so not doing my day job, and I call my day job what was providing some remuneration for me, but now I'm retired and I get to spend working, if we want to call this working, volunteering, whichever, which is my passion. And so ASH has been the organization that I want to spend my time and experience and passion with to move subjects forward. So I don't know if you want to ask me a question, because besides the human rights-based approach, which ASH has taken over and done this amazing job in moving it forward, but the other aspects of it is the criminal liability that ASH is quite central on, both internationally, nationally, and internationally, of holding the tobacco industry financially accountable for the millions and millions of deaths that they have caused. And I am 100% supportive behind that, and how can I help? And the next one is a newer project, which is Project Sunset. And that's what you have behind you is Project Sunset, which is now an innovative idea of ending combustible tobacco sales. And how can we do that both nationally, and in the US, that would be state by state, and then internationally, how can we do that? And how can I use my background as a thoracic surgical oncologist in order to help move that issue forward? So when I think of it, there's just innumerable reasons why I want to work with ASH.
So can you tell us a little bit from your background as a thoracic surgeon, what is the toll that you've seen smoking take on people's lungs and their lives? What is that impact you saw?
It's interesting. It brings tears. I would see people, what I think of my days in the clinic, When I first started doing thoracic surgery, and my passion had always been for lung cancer, so there's many other diagnoses that thoracic surgeons work on, but my interest had been lung cancer because caused by tobacco. And the average age at the time when I started was 65. So in the United States, that's the average age of when people retire. So I would see people come into my clinic and they were referred to me because they had a spot on their lungs. And everybody knew, or most people knew, that if you had a spot on your lungs, it probably was lung cancer. People were too afraid to talk about diagnosis of lung cancer because it was so scary. And at that time when I had started, the 5-year survival was 15%. So statistically probable that they would not survive 5 years. And 3/4 of patients who present, and this is still pretty true across the US and the world, are in advanced stages of lung cancer. So they're not in the early stages that have the potential cure from having surgery to remove it. So I knew when I saw that couple that they had recently retired, they were coming to see me, and I knew that they did not have a statistical chance of surviving the 5 years.
Wow.
And so when I tear up about that because I think of specific patients that was the case. And when I put up the x-rays, I knew very quickly which category they were in. And as you get to know your patients and you know that they recently retired, they have plans. There was one woman who had booked a trip, a 3-month trip, a cruise that she was going on. She had been looking forward to her whole life.
Yeah.
And then the question is, can she go on it? And so when I think about that clinical practice of it, there's ways that you learn to deal with it so that I'm not in tears all the time. My question is, how can I help them? Because I did not cause this problem, but how can I help them? And then the next thing that was very, very true and became so clear with that was that this is a preventable disease. Now, not all lung cancer is preventable. Somewhere around 85% of all lung cancers, and the number is a little bit lower in women, a little bit higher in men, are caused by smoking. So there are cancers that occur from other causes. Secondhand smoke, which is going down in places that don't have so much secondhand smoke because of good tobacco control, or radon. So it turns out I live in a high radon area. So I put in radon mitigation so that I am not exposed to radon to lower my risk from lung cancer. And then the other ones are just unknown reasons why people get lung cancer, whether a family history of it, so some genetic issues, or what else that we really don't know. But overwhelmingly, the number of cancers in the United States and in the world are caused by tobacco, by cigarette smoking. So those are preventable. And so when I think of that, then that gives me more energy to do the work of tobacco control. In both in the US and then internationally, because the US is, we're down to around 14% adult smoking. It's getting there. It's way too high, but it's getting there. But there's other places in the world that the rates are still climbing, particularly, say, in young women or in men. And lung cancer is the number one cause of cancer deaths. And I'm going, God, from cigarettes, from a preventable cause. And so that, as you can probably see, makes me pretty passionate for how do we stop these deaths that occur quite quickly, are devastating emotionally, obviously to the patient, but also to their
Absolutely.
family. And it's preventable. And the other aspect of it that many clinicians don't know is that the overwhelming majority of adults who smoke wish they had never started. They started as a teen, as a young teen, and they became addicted. Nicotine is remarkably addictive. That's probably another topic, but it's remarkably addictive. And so there you are as an adult, addicted to something that is 1 out of 2 or even higher than 1 out of 2 people will die from a tobacco-related disease. And I just think that's so wrong. It's just so wrong. So my passion
Absolutely.
for doing tobacco control.
Yeah. I mean, we can tell you're passionate about it. You have a lot of experience in it. And thank you for all your work with patients around the world and with ASH. So I think just drawing on your passion. So what made you choose ASH? You spoke a little bit about our programs, but so you want to prevent this, you want to prevent that toll from happening to more families. There's a lot of nonprofits out there doing this work. What draws you to us specifically?
For tobacco control, because I have a few voluntary organizations and interests that I do, but what takes most of my time is what's driven my whole career from when I was a teen. So I admit both of my parents were smoking. I was afraid they were going to get lung cancer, and so that drove the career. And then when I'm looking at spending more of my volunteer time, how do I pick ASH? And I go, well, as I described before, I had worked with the people within ASH. It's actually, number of people is a small number, but they are just as passionate about not having people die from tobacco. They're just as angry as I am at the tobacco industry for doing what they're doing. And they all agree it's just wrong. It's not unequivocal. It's just wrong. And there's a multitude of ways to approach this problem, and ASH is addressing them in many ways. Full-time, head-on, strong, passionate. So actually, it's not a hard choice.
Well, I'm glad to hear that. And so if other people out there are just as angry at the tobacco industry as you, recognize that smoking is a problem, what would you encourage them to do? How could people get involved, or what would they do?
There's two things, and one of them in the United States, we're in the middle of an election, which I think much of the world is aware of what's going on in the US with our national election. So I would say whether you're in tobacco control or in your community, step up. Step up and get involved. I have bumper stickers on this car that says, get involved. It's people who show up that decide what happens. So show up and do the work. And volunteer. There's ways to volunteer with ASH. There's ways, I live in the state of Colorado. There's ways of working locally within my county. There's ways of working with the state on moving towards stronger tobacco control laws. The other way is that if you can't, then donate funds, because ASH is a not-for-profit. So there's ways, if you're going to do the different activities that are being done in ASH, it does require money to do that. And for example, when I was talking about the Conference of the Parties, well, it costs money to go to that meeting in order to be the secretariat to run it. Now, to be clear, I know ASH is no longer the secretariat. You know,
Right.
that's moved onward to a group that's in Canada. But you know, there's ways you could donate to them, you could donate to ASH, because there's still the activities that are happening. For example, Project Sunset has had tremendous success in California. But even to do that requires funds. To do this Zoom, you have a, what's it called, the contract or whatever, subscription to do
Yeah.
a Zoom. Well, in order to do that, that costs money. So I know that ASH is not a, oh, what do you call it? They're not spending it on your salaries. I'm pretty aware of that that's not happening. The other thing too is that the board that oversees this is a group of who's who in tobacco control, and so they have a very close watch too, but also interested in being financially responsible. So the two things that I would say is, one is to donate to ASH, and if I'm not mistaken, the easiest way to do that is just go to ash.org, and there's a place on it that says donate here, donate now, something like
Yeah.
that.
Hmm.
And then the other thing too is to volunteer. So whether you volunteer with ASH that is based in DC, or you volunteer with more locally, whichever you do, I would just say get involved, because it is wrong. And unless people step up, it isn't going to get fixed.
Thank you so much, Carolyn. We appreciate everything you had to say and your ongoing contributions to ASH. You play a crucial role in all of this for us, so we definitely appreciate you.
Thank you. It helps me too, because it's what I want to do. It's where I want to spend my time, my passion, my experience. So thank you.